All right, so today I'm going to be doing a medication administration for my patient, Kevin Hart. First things first is I'm going to wash my hands, and then I'm going to do my 3 checks and writes. So my first check and write is going to be with my MAR right now, generally with another nurse. My second check is going to be before I enter the patient's room, and my third check is going to be at the patient's bedside. So what we're doing today is I'm going to give you a list of the patient's medications, what we're doing. So the first one is acetaminophen. The ordered dose is 325 milligrams of acetaminophen orally every 6 hours. The recommended dosage is 325 to 650 milligrams every 6 hours, or 1 gram 3 to 4 times daily. What this is going to tell me which medications I need to give my patient and the right amount of doses. So my second medication is atenolol. The ordered dose is 50 milligrams orally every 24 hours at the hours of sleep. The recommended dosage is 50 milligrams once daily, and it may increase after 1 week to 100 milligrams daily, so it matches. My third medication is atorvastatin calcium. The ordered dose is 10 milligrams orally every 24 hours at the hours of sleep. The recommended dosage is 10 to 20 milligrams taken once daily initially, and may increase every 2 to 4 weeks to up to 80 milligrams daily. My fourth medication is hydrochlorothiazide. The ordered dose is 12.5 milligrams every 24 hours. The recommended dosage is 12.5 to 100 milligrams per day in 1 to 2 doses. My fifth medication is oxycodone hydrochloride acetaminophen. The ordered dose is 1 or 2 5 oxycodone over 325 acetaminophen orally every 6 hours depending on pain. And the recommended dose is oxycodone 2.5 to 10 milligrams and acetaminophen 325 milligrams orally every 6 hours as needed for pain. My sixth medication is codeine phosphate acetaminophen, and the ordered dose is 1 or 2 30 milligram tablets every 6 hours for pain. And the recommended dosage is 30 milligram tablets every 6 hours for pain, so they match. Ketorolac is my seventh medication, and the ordered dosage is Toradol 15 milligrams intramuscular every 12 hours in the span of 3 doses, where the first dose will begin at 9 a.m. The recommended dosage is 30 milligrams as a single dose, or 15 milligrams every 12 hours, just like the ordered dose. So with that, that's my first check and write. So now I'm going to go to my patient, and before that, I'm going to get him a cup of water. And now we're ready to go. How are you doing today?
Good. How are you?
Good. My name's Tyler. I'm going to be your nurse today. Okay. First things first is I'm going to check your band. Can you tell me your first and last name?
Kevin Hart.
Okay, and your date of birth?
February 20th, 1980.
All right, that looks good. And I looked at your chart and I see that you had Chickenpox as one of your allergies. Is that correct?
That's correct.
Okay, good. Just wanted to make sure. So first things first is I'm going to be delivering oral medications. So what I'm going to do is I'm going to have my patient sit up a little bit. So I'm going to have you sit up. Thank you. And the first medication is going to be acetaminophen, which is one of our scheduled medications. And it's given for mild pain to fever. So I'm going to be giving my patient 2 325 milligram tablets by mouth orally every 6 hours. And for this medication, I'm only going to give it if my patient's temperature is over 100.4 degrees. So to do that, to give my medication, I have to check my patient's temperature. So I'm going to check Mr. Hart's temperature, and it came out to be 98.4. And with that, I just went ahead and checked the rest of his vital signs before I started giving any more medications. His blood pressure was 132 over 80. His temperature was 98.4. His respirations were 14, and his heart rate was 66. So all these are normal. So now that I've checked his temperature and I've seen that it's 98.4, I'm not going to administer acetaminophen, and I'm going to, on my computer, tell you why and why I didn't give this dose, because his temperature is under 100.4, so there's no need to give a medication. So my second medication is going to be atenolol, which is another scheduled medication, and this drug is basically for the management of like hypertension and to prevent cardiovascular disease. So what I'm going to be doing is I'm going to be giving 50 milligrams once orally every 24 hours at the hours of sleep. And to do this, I need to check Mr. Hart's blood pressure. And I've done that already, and I've seen that it's 132/80. So this does fall in the range to get his medication. So this is going to be my first oral medication given to my patient. So what I'm going to do is I'm going to place the medication generally in a paper cup, and then with a cup of water, I'm going to get them to take it. Thank you. I'm going to make sure to watch my patient take their medication before I do anything on the computer, so I don't mess anything up. All right, and my third medication is going to be atorvastatin calcium, which is another scheduled medication, and this is basically for the management of hypocholesterol. I'm going to be administering 10 milligrams by mouth once every 24 hours at the hours of sleep. And some of these side effects that I'm going to need to mention to my patient are going to be confusion, dizziness, headache, and sweating. Since I'm looking at this medication, I'm going to be giving it the same way as an oral like I did just earlier. So I'm going to give my patient their medicine with water. All right, and my next medication, which is another scheduled medication, is going to be hydrochlorothiazide. And this drug is used for the management of mild to moderate hypertension. And I'm going to be administering 12.5 milligrams daily every 24 hours. And once again, since this is a hypertension medication, I'm going to check Mr. Hart's blood pressure. And he does fall in the normal range to give it. So side effects are going to be dizziness, weakness, hypertension, and some mild nausea and vomiting. Okay, this next drug is going to be a PRN, or it's going to be an as-needed drug, and it's going to be oxycodone hydrochloride acetaminophen. And this drug is used for the management of moderate to severe pain. So before I give my medication, I need to see how much pain my patient is actually in. So Mr. Hart, on a scale from 0 to 10, 10 being severe, 0 being no pain at all, what is your pain level?
A 5.
Okay, a 5 is going to fall in the moderate to moderate pain level. So generally for this medication, it's only for severe pain. So now that I know it, I'm not going to administer this medication because they do not fall in the recommended pain level. But I will go ahead and let you know that the side effects of this medication are headache, orthostatic hypertension, and flushing or sweating. And since I didn't give this medication, I'm going to document the reasons why I didn't do it. My next medication is going to be codeine phosphate acetaminophen, and this is also going to be PRN as needed, and it's generally dealt for moderate pain. I would again need to check Mr. Hart's pain level, and now that I already know it's at a moderate level, codeine phosphate acetaminophen is generally only for moderate pain, so I know I can give my patient this because they are experiencing some level of discomfort. And some of the side effects of this are going to be lightheadedness, dizziness, nausea, vomiting, and shortness of breath. And my last medication given is going to be ketorolac tromethamine, and this is going to be a scheduled intramuscular injection. And this drug is used for the management of moderate to severe acute pain for single dose treatment. This is an intramuscular injection of 15 milligrams over 3 doses every 12 hours. And some of the side effects are nausea, headache, dizziness, and pain generally at the injection site. So since this is an intramuscular injection, I'm going to demonstrate how we do that. So first things first is I make sure I have my gloves on, that I've washed my hands, and I'm going to go ahead and get an alcohol swab, and I'm going to swab the top of the vial used for the medication. And not only am I going to swab that, but I'm generally going to swab wherever I'm injecting it on the patient as well, in a circular motion getting bigger. After I've swabbed the vial, I'm going to go ahead and get my needle prepared and make sure to take safety precautions. So first thing I'm going to do is I'm going to uncap my needle. And since I'm going to be giving 1 milliliter of medicine for this checkoff, I need to have 1 milliliter of air inside this needle. So I'm going to go ahead and get my milliliter. Once I have a milliliter of air, I'm going to inject the milliliter into the vial. All right, once I've injected the milliliter of air into the vial, I'm going to go ahead and inject the same amount into the needle. So I'm going to do a milliliter of medication. All right. And once I have that prepared, I'm ready to go ahead and inject my patient. Since this is an intramuscular injection, we're going to use the Z-track method. And what the Z-track method is, with my non-dominant hand, I'm going to pull the patient's skin to one side to make sure there's so I can stretch it out. And I'm going to go in with bevel up at a 90-degree angle. I'm going to make sure to keep holding the skin while I'm injecting the needle, because I don't want the medication to escape, and I want it to go directly into the muscle. All right, then I can let go. And once I've administered and injected the patient with needle safety precaution, I would close the needle cap and then dispose of it inside of a sharps container. And the sites for an intramuscular injection are going to be the deltoid. And if I was doing it in the deltoid, I would look for the acromial process, and go 3 fingers down from it and inject at the bottom of my last finger right here. My next spot is going to be the vastus lateralis. So what that is I'm going to look at the anterior part of my leg, and I'm going to divide it into 3 sections. 1, 2, and 3, and I'm going to inject at the middle site. And the last one, which is generally the best for giving intramuscular injections because of the amount of muscle in that area, is going to be the ventrogluteal area. And what that is I'm going to show on my patient. I'm going to get you to roll over on your side for me. What that is I'm going to look for the greater trochanter of the femur, which is going to be generally in this area. And I'm going to have my thumb facing the groin. And I'm going to have my index and my middle finger spread apart. And I'm going to give the injection right in between them there. Now, for the sake of our patient, we didn't have a subcutaneous medication needed. So what I'm going to go ahead and do is already explain how a subcutaneous injection works. So with that, there are several spots for subcutaneous injection. It's going to be the anterior part of the thigh, the lower part of the abdomen, the anterior and posterior arm, the top part of the back, and then the lower part of the back right above the gluteus maximus. And with doing that, it's going to be the same really process of injection. And I'm going to go ahead and do that again. So I'm going to make sure to swab the top part of my vial. And then I'm going to make sure to swab in a circular motion on my patient where I'm going to inject it. I'm still going to take the same needle precautions. I'm going to uncap my needle. Get 1 milliliter of air for 1 milliliter of medication. And then I'm going to inject that 1 milliliter of air into the vial. And then I'm going to inject 1 milliliter of medication to match it. And now we're ready to give the injection. Now for subcutaneous injections, we not going to use the Z-track method. We're actually it's going to be dependent on the patient's body build and body weight. So what we're going to do is, I have a thinner patient. So what I'm going to do is I'm going to pinch the skin 2 to 3 inches so I can reach that adipose tissue layer. Generally, if I have a bigger patient, I don't have to pinch the skin. And since I'm using a thinner patient, I'm going to pinch the skin 2 to 3 inches. And then I'm going to go at a 90-degree angle into the adipose tissue layer and inject and let go. And for larger patients, we would go at a 40-degree angle. And then after that, I would do safety needle precautions. So I would close my needle and then put it in a sharps container. All right, and then an example of a subcutaneous injection would be insulin. And one of the main differences while prepping the injection is that we'd be using a U100 insulin syringe to tell for units instead of just a normal syringe. And to figure out how much units of insulin we need to give a patient, we have to look at their blood glucose level. So we'd get their blood glucose level, we would minus it by 100 and divide by 20 to figure out the amount of units. And one of the signs of somebody who needs or has poor insulin or needs insulin is if they have hypoglycemia. And signs and symptoms of hypoglycemia are lack of coordination, pallor skin, coldness, lightheadedness, and headache. And I'm going to go over other medication sites and administrations. So with that, we would have another medication site would be a suppository. What that is I'm going to lubricate the suppository, insert it inside of the rectum, and let it go past the inner sphincter for 20 to 30 minutes. And I'm going to make the patient hold it for 20 to 30 minutes so the medication can go through. Another site is the optic or the eye. So what we do is we would lower the eyelid, and then I would inject the medication into the lower conjunctival sac, making sure not to touch the cornea or hit the cornea, and making sure not to touch the applicator bottle or dropper to the patient's eye. The next site would be nasal. So what I do is I get my patient to tilt their head back, and I would use droplets to drop it into their nostril. Another site would be the ear. And generally for an adult, I'd have them turn on their side and pull on the upper part of the helix of their ear. And I would administer the medication into the inner ear canal. And it's really important when you're doing ears when you administer to one ear, you need to wait 1 to 5 minutes before you administer it to the second ear. Another part would be the sublingual, and the sublingual is going to be administered underneath the tongue. And after that, you have the buccal, which is going to be inserted either through a needle on the inside of the cheek right here, or you could go inside of the mouth and have the medication go on the inside of the cheek. So now we've administered all our medications to our patient, and always proper standards is make sure they don't need anything, make sure they're comfortable, make sure their bed is in the right position, and if everything's okay, then we're ready to leave, and we'll be back to administer whatever medication needed on the proper time. Thank you.